Doctors at Northwell Health say they want to further help immigrant communities here in New York, and that's just one reason why they're heading to Guyana.
For Indo-Guyanese people, they are disproportionately, cardiac disease is a huge problem.
Building cultural competency in communities of color in New York is key for doctors at Northwell Health.
We're going to be speaking with doctors that are working in these regional health systems. We're going to speak with the coordinator of the mental health services for Guyana.
Dr. Choi Pena is the director of global health at the hospital system and an emergency physician on Staten Island. He's also heading up a mission in Guyana, the South American country culturally connected to the Caribbean.
Because we're so proximal to the Guyanese population in Queens, because we're so proximal in New York to taking care of, we have an enormous patient and employee population that is Guyanese American. We really see it as a multi-pronged approach.
New York is home to the largest Guyanese American population in the country. Dr. Choi Pena says that's why going there to understand how their health problems began is important.
There's things that communities are either genetically or environmentally predisposed to. So we see things like elevated rates of cardiac disease in West Indian Americans, right? We see elevated rates in Guyana of suicidality and completed suicide and mental health issues, right? We're seeing things, that may have problems that may have started in Guyana, like prenatal care that started in Guyana and ends up in Long Island.
The team of more than a dozen is also going to help the country rebuild its healthcare system.
Guyana has an enormous burden of non-communicable diseases that have just started, like heart attacks, strokes, car accidents.
A group went back in November to survey the country, hospitals and clinics, and meet with health and government officials.
We brought down 6 different departments at Northwell, including psychiatry, pediatrics, pathology, OBGYN, family medicine.
The medical professionals will be visiting all regions in Guyana, and as they learn tropical medicine and broaden their cross-cultural understanding to help address health disparities here in New York City, they're also hoping to build better trust among their patients and their patients' families.
Global health is local health, and global is local. And you really, to fully understand a patient's story and history, seeing where they're from is tremendously illustrative.
And a team of doctors from Northwell Health will head to Guyana on Monday. Hospital staff says a rotation of doctors and medical professionals will be in the South American country for 5 years, providing services there and bringing back what they've learned to their patients here.